Hi everybody, I'm Dr. Chong Yun Sin. I'm a consultant cardiologist in Park City Medical Center, Malaysia, Kuala Lumpur. I've been here for the almost past 10 years as a consultant cardiologist. I practice intervention cardiology for more than 20 years. I love intervention cardiology because it involves specialized skill and work of the result is very satisfactory for me and my patients as well. Every morning I come to hospitals about 7. I will start off with a clinic computer work to see how I should schedule my patients. I'll organize all my patients first, and then in the morning I will start with my rounds to see my patient from yesterday's. Are they doing well? Are they ready to go home after the surgery and so on? And after finish all the ward works and so on, I will start with my busy clinics. I see quite a number of patients. We deal with various heart problems and conditions. And afternoons, I will just focus on procedure or operations. So I do not want to be disturbed, so all my cases are complex, so I need to be focused on my patients to make sure I give the best to the patients. Cardiology today is very advanced and it managed to treat a lot of very complex lesions. 20 years ago, we are still very primitive, but over the past 20 years, cardiology has advanced tremendously over the past 20 years. And he achieved the kind of technology that we can treat most coronary artery lesion, complex. The best thing for intervention cardiology today is that we're able to do needle hole procedure for very complex lesions, and the patients are well post-procedure and they're able to discharge the following days. So we managed to save patient life, we managed to treat the difficult complex lesion, and we managed to keep patients alive for many years to go. Most of the patients that come to see me are patients who have a heart problem, mainly coronary artery disease, which is a blood vessel blockage. These are usually because of diet, smoking, high cholesterol, even genetics and diabetic as well. So most of them come in is for me to assess whether they have coronary artery disease. So we will do a thorough examination to see any of the problems. And then we'll do some basic tests like ECG, stress test, ultrasound, and sometimes we move on to heart scan, which we can do a scan to visualize the blood vessels of the heart to see whether any obvious or significant blockage. If let's say we do found some significant blockage of the blood vessels, we can proceed and move on to coronary angiogram, which we can do a small needle puncture through the wrist with a 1.8 mm tube and enter the heart and to see where is the blood vessels and whether we can do an angioplasty to fix the blood vessel blockage. So this is the small little procedure which only take about a few minutes. If we found nothing or minimum or no blockages, then we will come out and we will just put a small compression to stop the bleeding. If let's say we found a blockage in the blood vessel, we will proceed and move on with a small tube and balloon to open up the blockage, and that will take another half an hour to 1 hour, depending on the complexity of the vessels. My job is actually a lot of times very satisfaction, especially when I'm able to save a person's heart, from near death. So a lot of patients after being treated, they are well and move on with life. They're very appreciative, and quite a number of them they actually come and thank me personally, and some of them they actually give me a huge plate called 救星, basically a lifesaver. As an advice for general public or any viewer there, I always encourage them to do prevention and screening. Prevention and screening is most important in heart disease, because in heart disease it's preventable and we detect early is life-saving.